Hello and welcome to our mini-series workshops on C-section recovery. My name's Leonie Rastas, the C-section recovery whisperer from Caesar, and we've created a series of mini workshops on subjects to do with C-section recovery. Right, so hello again, and welcome to this mini workshop exploring the top 4 challenges after caesarean birth. At the end of the workshop, I hope you'll have a good idea of the challenges and struggles after C-section and have some understanding of how to mitigate those challenges. At the end, there'll be a time for questions if there's more information that you need. So let's get started. Many women are underprepared for the postpartum, and that's largely due to the relative lack of antenatal education, as well as the number of unscheduled caesareans of an emergency nature. Fear of the unknown can create a lot of anxiety, so it's a really good reason to prepare yourself with the knowledge to have a positive experience and to allay the anxieties that sometimes can be unfounded and maybe even inspired by things that you've seen on television that perhaps don't happen today. Also, unrealistic expectations and the myth that a C-section is the easy way out. Some even say it's equal to vaginal birth with less complications. But diving deeper into the subject, you'll easily see that it is really not the easy way out. Also, some say that caesarean birth is not real birth. You haven't pushed the baby out. And that can cause guilt, failure, shame, and some even a stigma against caesarean birth. When I had my first unexpected C-section, I knew what was about to happen. As a midwife, I'd seen it all before. However, I had no idea what came next. It was a huge learning curve, and I had no family support nearby, so I had to learn through experience. For the subsequent C-sections, I was well prepared. I knew what I had to do to have a hassle-free recovery. So it's my hope that, unlike me, you will feel well-informed, strong, proud, and confident after this workshop. We're going to look at the actual surgery, not in detail, just a brief overview of the surgery. So you will usually be admitted to hospital. If it's a scheduled C-section, you'll be admitted to hospital the day of, and you may walk into theatre or you may be wheeled on a trolley. You'll have your epidural anaesthetic, if that's what you're having, or your spinal, inserted, usually in a separate room. Then you'll go into theatre. The actual caesarean procedure can take anything from 20 minutes to 30, 45. It's not a long procedure. So, you just to be aware that it has a beginning and a very happy ending is often a great help. So it can take, say, 30 to 60 minutes from start to finish. It's important to know that caesarean section is classified as major surgery. There are 5 layers involved. We have the skin that is cut through, then the subcutaneous layer, the muscle, and the peritoneum, which is a film over all of the abdominal organs, and then the uterine muscle finally to allow a baby's birth. So all of those layers need to be reunited and either stitched, stapled or glued together for healing. So the challenges, in order of from the poll, what we found was the incision pain was voted the most troublesome, followed by coughing and sneezing, and I'll talk a little bit more about that. Then constipation and walking were the other two areas that caused challenge after surgery. So these results are quite different to results of a poll I read 3 years ago, where constipation was voted the number one struggle. So it's good to see that that issue has been addressed and is well managed today. And I know from clinical practice, these days a lot of women are ordered a perience on day one after birth so that they can prevent the likelihood of constipation. So we'll start with the incision pain and just talk about where the type of pain that you will feel, where that comes from, and some ways that you can help reduce that pain. So as I've said the 5 layers are cut through, and the body has a natural reaction to trauma to become inflamed. So that's the first response, inflammation of the tissues around the incision where the trauma has been registered, begins to pool. And that's the beginning of the repair phase. So once the stitches are in, the healing begins. Oral pain relief will be given at this stage, and an ice pack also can offer added relief. So it's important to keep ahead of the pain, to make sure that you take your pain relief regularly. And it's also important to keep your bladder relatively empty so that there's no pressure from the inside on the internal stitches inside. So very important to get up and go to the toilet once the catheter's out, and not to delay it, because that can intensify the pain. So the healing time takes 5 to 6 weeks to fully close and heal all 5 layers. So it's important not to strain the area from heavy lifting, just the mechanics of driving, or any strenuous exercise. After 6 weeks, once the doctor has reviewed the incision and the healing, then you could commence scar massage, which has been shown to be very beneficial to reduce adhesions where organs can, become quite tight and stuck together. So it's good to be able to do that, and there's a lot of guidelines on how to do that. Mobilising. Now, it's tempting not to move unnecessarily after surgery, but it's really important. Research has shown us it's really important to be up and walking 6 hours after surgery. You will, of course, need assistance for getting out of bed and the first few times that you walk, but it's really important. And a good tip is to roll onto your side and push yourself up with your upper hand. Push yourself up, then swing your legs over to avoid that trying to get up from the lying to the sitting position. So just rolling on your side is a good tip. Preparation. We know that knowledge is power, so learning what will happen at your health facility if a C-section is needed is important, just to understand the procedure, what will happen, especially in the event of an emergency caesarean. It's just good to know what the process will be. So that sort of helps allay any anxiety and puts you clearly in the picture. Also, packing your hospital bag with extras like a cold pack. Music can often be helpful in theatre, and a cushion. A cushion to hold over the incision during coughing and sneezing can be really helpful, just to give you reassurance that, you've got support there over the incision. It's also really important to prepare your mindset. You might hear all sorts of stories from well-meaning people about what might happen, but it's really important that you are able to visualize a really positive experience and to trust your medical team. And maybe even some meditation can be helpful. I know hypnobirthing have some wonderful positive caesarean birth resources. So just making sure that your mind and your body are really well prepared is a great idea. So understanding the limitations that C-section brings is a really important starting place. So you will need support with cleaning, shopping, meal preparation, washing and household chores. Remember that many people who have major surgery have weeks in rehab to strengthen. So give yourself permission to share the load. For 6 weeks, it takes 6 weeks to heal the wound and many months to feel as strong as you were before pregnancy. Just be kind to yourself and help yourself restore. In summary, the keys to overcoming the challenges of C-section birth are acquiring knowledge, preparing, engaging in preventative measures to prevent problems, and soliciting support from friends and family. One-to-one coaching is available from Caesarcare. We have a great ebook, a small ebook that talks about preparation, other little tips and tricks for preparation and recovery and troubleshooting after, what to look for and when to seek help. Recently, a colleague from the UK, a midwife over there who's worked extensively with women after caesarean birth in the home, joined together and produced a C-section recovery manual. And it's quite a unique resource in that it's 3 sections. The first section is 12 chapters of knowledge about all that goes with caesarean birth and also future births. There's a section there about what to expect for future births and the potential of a vaginal birth in subsequent pregnancies. We also have some blank journal pages there for you, and encourage you to sort of work through those and document your milestones and your struggles and your victories in the recovery phase. And then finally, we have a section with checklists, a daily planners for you, just to keep you on track with your medications and your water intake and little tips and tricks for each week of your 6-week recovery. In addition, we have added a scar tracker because it's so important for you to be aware of how your healing is going. And so we encourage women to use a handheld mirror or stand in front of a full-length mirror and observe their incision and the healing progress each day so that you can be really alert to any early warning signs. We also have a Facebook group, a free Facebook group where you can join and meet other mothers and ask questions. And at Caesarcare, we also offer C-section recovery packages. So I hope this has been helpful for you, and I invite you now if you have any questions to ask. Okay, so how long do I need painkillers for? Well, that's really up to each individual. What happens is you will be prescribed a regime of medication, And it's really important not to knock back any. It's good to just keep a good coverage, because if you skip a dose, you'll find the pain spikes and it makes it difficult with everything, with walking, feeding, showering. So keep ahead of that. And every individual is different. Every individual's pain is unique. So some people take the pain relief for several days, some several weeks. It's really what you need to function well for you and your baby. Okay, another question. When can I drive again? Well, that is really up to you and your doctor. The reason you're not meant to be driving in the early phases is you need to be able to respond quickly if there's an emergency. And if that's going to cause you pain and stop you from taking emergency action, well, then it wouldn't be safe to drive. And certainly your insurance company would be looking at whether you were pain-free when you were driving in the event of an accident. So it's really a discussion that you could have with your doctor, or if you know that you're totally pain-free, then you can drive when that situation arrives. Okay, sleeping positions. When can I sleep on my stomach? Well, that really, again, depends on your individual pain score. It's usually a few weeks, but if you're well supported with pillows, you can probably just whatever your pain allows, basically. And I think it's really important that that you test that and don't push yourself. You know, if you're used to sleeping on your stomach and you're dying to get back to that, well, just pace yourself and see how you go. Okay, so how can I prevent complications with my incision? Well, the main complications with your incision are infections and breakdown, stitches busting open. So with infection, it's really important to clean your hands when you're touching the wound. Make sure you're always well cleansed hands, and when you shower, just use a mild soap. Just run the water and a mild soap over the wound and pat dry with a very clean towel. That's most important. In terms of breakdown, it's really important to support that wound during coughing and sneezing and even laughter. So a rolled up towel or a cushion is really important to just have at the ready if you need to do any sudden movements. That will help protect your stitches and give you more comfort. It'll reduce the pain that you might feel with the coughing or sneezing. And incidentally, I actually designed a simulation of a rolled up towel. You can see that it's called the SAC splint, or the surgical aftercare splint, which is on my website, which women have found really helpful. But a cushion and a rolled up towel is just as good. So I think that's about all the questions for now. So I'd like to thank you for being here for this mini workshop, this near 20-minute workshop, and I look forward to seeing you in future workshops. So all the best for your C-section, and remember, you are a warrior. Not every person can have major surgery while fully awake and manage the situation. So well done and best wishes. Bye for now.